As the skin and tissue is dissected and redraped on your abdominal wall, some fluid and blood collects under the skin. Occasionally, the fluid does not reabsorb. A collection of blood called a hematoma or clear fluid called a seroma may need to be drained postoperatively with a separate and much smaller procedure. This usually is of no consequence to the quality of your final result. An excess collection of blood in your surgically dissected tissue is called a hematoma. This may require another operation to drain and occasionally blood transfusions. Frequently, your surgeon will place a small drain in the area to remove fluid and allow a faster recovery period. The drain is easily removed in the office within a week of surgery. This is an example of a drain which might be used. The small tube is placed in the dissection area underneath the skin and drains unwanted fluid into a container or bulb on the outside of the body. Most patients have some loss of sensitivity in their abdominal skin, however, this usually returns with time. Numbness or discomfort could be permanent, however. Although great efforts are made to place your belly button in the ideal location, malposition might occur and result in a belly button which is off-center, too high, or too low. When these skin flaps are elevated as previously described, the blood supply or circulation to the skin is altered or compromised. This blood supply is necessary to keep the skin alive and allow ideal healing. If an even more significant compromise of the rerouted blood supply, such as with an infection occurs, poor wound healing, possible wound separation, and even loss of skin and tissue can result. Although uncommon, it is most likely to occur at the central portion of the incision or the belly button. There are many variables that could further compromise the blood supply and diminish healing ability. Smoking reduces blood flow and adversely affects healing. Excessive tension on the skin from the closure, excessive postoperative activity, infection, and the presence of previous surgical scars can diminish blood flow and adversely affect healing. If liposuction is performed on the abdominal or flank area at the same time as the tummy tuck, the risk is significantly increased because of the extra trauma. In the unlikely event a small portion of skin did not live such as this, there would be prolonged healing, most likely including frequent dressing changes and a revisional procedure. Permanent deformities can occur. These procedures are also more risky in those that smoke, are obese, or have associated medical problems such as diabetes. It is best to optimize your medical health prior to the procedure to increase your chances of a smooth recovery. Incisions always result in scars, which heal unpredictably based on the previously discussed variables. Although they usually heal well and are an excellent trade-off for the benefits of the procedure, sometimes they can heal poorly and cause discomfort and anxiety. Here are examples of how variably scars heal. On the top are scars which have healed poorly and are obviously very noticeable. On the bottom are scars which have healed better and are less conspicuous. Because of the associated relative inactivity of the healing period, there is also an unlikely but slightly higher risk of developing blood clots in the legs. Rarely, these blood clots or clots of fat can travel in the bloodstream to the lungs. This is called pulmonary embolization. These events can lead to the need for hospitalization and occasionally shock and death in the most severe instances. Precautions taken during surgery, such as placement of compression stockings, significantly lower the risk of this rare complication. A return to activities such as careful walking soon after surgery also decreases these risks. It is extremely important to go over these and other risks with your surgeon and have your general health evaluated. Other complications can result from any surgery, resulting in permanent deformities, need for expensive revisional surgery, hospitalization, and even death. The rate and severity vary with different surgeons, their experience, and the medical health considerations of each patient. You should discuss all these issues and related financial obligations and responsibilities with your plastic surgeon prior to surgery. An abdominoplasty should usually be performed under a general anesthesia. The time it takes to perform the procedure varies among surgeons and with the extensiveness of the procedure. Postoperative instructions also vary with surgeons and should be carefully followed to increase the likelihood of a favorable result. Generally, sutures need to be removed and your surgeon will need to carefully monitor the healing process and evaluate for the development of any potential complications. Major tummy tucks often require a prolonged recovery period with significant limitation of activities. The postoperative discomfort and recovery time do vary from patient to patient, but most patients don't get back to a desk job before several weeks, or regular activity before 1 to 3 months. You will increase your chances of a better scar and less problematic wound healing if you keep tension off your incision as it heals. This is best accomplished by walking bent over with the aid of a walker and keeping flexed at the waist as shown here for about 10 days following your surgery. Sitting in a chair as much as possible and lying in bed with your legs and back flexed also keeps the incision area soft and tension-free. You should try to avoid lying down flat or standing up straight for even an instant for the first 10 days. It is important that you follow your surgeon's instructions very carefully and show up for all your scheduled appointments.
The next video segment follows the pre- and post-operative course of a patient who will undergo a tummy tuck or abdominoplasty procedure.